focusing here in Africa. The public health schools of veterinary medicine in the 7 countries are listed here. Again, this is our implementing partner here in Africa. So all the work that we do is through this network. What are we doing as part of One Health Workforce? We have 5 objectives. We're supporting our university networks to work with government and other stakeholders to identify workforce needs and develop workforce maps. We're supporting our networks to train the future One Health workforce, so that's working with universities, as we've seen already, changing how curriculum is implemented, the content of curriculum, changing, developing masters or strengthening masters or other graduate programs. We're supporting networks to work with government ministries to train the current One Health workforce, so that's how do universities, working with universities to develop training programs that target people that are currently working in the field. And then developing faculty capacity to do this kind of work. And finally, creating sustainable networks themselves. So what this is about is building on university strengths. We've seen many models of how universities can be leaders in One Health and really be of service to the countries that we're in order to help countries be more prepared, be able to better detect, be able to better respond to infectious disease threats. And that's where this project is really focusing. How can we as universities be productive and useful and help make the workforce ready for the next Ebola epidemic? Currently, the workforce is isolated and very focused. Each sector has its own mission, its own effort in terms of its own responsibilities and roles within the country to achieve in addressing infectious disease threats in its own sector. Each sector also has its own international standards that it's trying to meet. And associated with that is international competency standards that I know many of you are working on in order to achieve to strengthen your sector. But what we're talking about with One Health Workforce is how do we take the strength of each of those sectors and combine them and integrate them to make a whole country workforce that's effective in addressing these threats. So really, it's about taking those single sectors, which can be weak individually, and strengthening them by be stronger together than they were in isolation. So cross-sectoral collaboration and coordination really binds those sectors in a way that makes them stronger as a whole. So when we have an outbreak, if we have a whole country approach, we can really have a best team response to an infectious disease threat. We can create a team that brings in people that are competent with technical competencies that can address the threat in the most effective way. So you can bring in the case of an outbreak, an incident manager from the emergency response sector. We can bring in an epidemiologist from the veterinary sector. We can bring in a risk communicator from the human health sector, and they can work together as a team. But part of that working together as a team is having the competency to do that. So you must be good at something first. How do you be a team professional? Be good at something. So have that technical expertise. Meet those international standards in your own sector. But you also must be able to see the big picture and have this holistic systems-based approach to how you do your work. You must have team-based skills. We heard a lot about this from Dr. Musanero when she talked about what was happening on the ground in the Ebola outbreak, where people lacked ability was not in their technical competency. And in fact, some of the most technically competent people were the least effective in the field. You must be able to communicate both up and down the chain, right? You must be able to communicate with the people, you must be able to communicate with the leaders or the policymakers, you must be able to manage the situation in an effective way, you must have leadership, as she talked about, down to the level of being able to manage logistics. These were some of the skills that were listed. you're at least capable in. You must be able to work effectively across sectors and with communities. You must get to work. So if we're thinking about training students, we've heard a lot about this, getting out into the field, getting experience. And then I think one of the important things that I think universities can bring to the table is continuous improvement of workforce and continuous improvement of the work. So you must measure, evaluate, and learn and share knowledge of what was learned in the field. And publish, it could be in reports, it could be in literature, but make sure people know the successes and failures so that people can learn from them. As we've talked about, we've developed One Health core competencies that are trying to address that team professional. And these are ways of mapping some of the skills and competencies that we need to integrate across those disciplines. And innovation and working with community, working with government, working with the private sector, and then working with other academic institutions to make a stronger team. So institutions can also be a strong team to address these threats. So we've already heard many of these models, and we'll hear more today. I don't want to steal the thunder from my colleagues that are speaking in this session. But we've heard already about revised curricula, the modules that Dr. Amaguni talked about that can cut across all of our dozens of universities to really influence a whole generation of students. New and strengthened graduate programs that can reach remote students, can reach students in the field, field-based master's programs, real-life work and field-based training. We've heard about the field attachments, the student clubs, where students are getting out and doing things in the world. The innovation sites or demonstration sites that where universities can create really deep and integrated and strong relationships with community and government in order to address community needs in a more systematic way that integrates research, outreach, and education. Partnering with government to train the current workforce. We've heard about the leadership programs, both the One Health leadership here in Africa, the Global Health True Leaders in Indonesia, but we're also thinking through ways that universities can play, what do universities bring to the table in terms of working with the current workforce? Well, things like continuing professional education might be one direction. It's very country specific because different countries play different roles in terms of in-service training. But we're really looking for ways to be innovative in terms of how universities can provide that continuous improvement of the workforce and also provide some of the benefits of universities like accreditation of courses. So what do we need to do to strengthen the workforce? We need to map the workforce. We need to develop innovative university-based training programs that meet the country needs as we identify them and as you all identify them as our stakeholders. Both sector-specific and cross-sectoral strengthening, accredit training, develop systems for ongoing monitoring and improvement. So our networks are taking a lead in One Health in their regions. We're developing students with skills to succeed in the workforce. We're developing a workforce that fosters the super team approach, the whole country approach. We're improving capacity across sectors to manage health threats, to work together, and then creating this close synergy and partnership between government, country, community needs, and university-based research, education, and outreach. Thank you very much.